So I'm at EMS World. This is actually the first video I'm going to film because I'm in the pig lab, which is one of the pre-con events. And I'm going to show you a pig heart because I want to talk to you about how clots form in atrial fibrillation. Okay, so here's our pig heart, and it's already been dissected. You can see that we have this big meaty left ventricle right here, and we have this smaller, thinner right ventricle right here. Look how thin that muscle is as compared to the muscle of the left ventricle. And that left ventricle is doing all the heavy lifting. Up here, we have our right atria, and we have our left atria, but we have these two appendages right here that look like little dog ears, and you don't hear about that too often in paramedic school. I don't know if your paramedic instructor wants you to even know about that, but it's really important when it comes to atrial fibrillation, because what happens is you normally have blood flow coming through this heart, and most of that blood flow is passive from the atria into the ventricles. But if your heart is really working hard, or you're pumping a lot of blood through there, your atria actually stretch out, and the overflow goes into these little appendages called the auricle. So here's the left auricle and the right auricle. Sometimes they're called the left atrial appendage and the right atrial appendage. And those balloon out when the heart's doing a lot of hard work. And you can see that inside those appendages that there is a lot of area for blood to collect in there. And during A Fib, that blood can collect in there because the heart isn't pumping very efficiently. And so the blood collects in all these little nooks and crannies and form these huge clots. And then at one point or another, the clot dislodges from that auricle and goes downstream. And that's where we have our problem.